Welcome to Raising Mommy, a podcast sanctuary where moms can come to listen, share, learn, and grow. I am your host, Kimberly Tyson, vegan blogger for eatplantsforlife.com, wife and mom of two. Here today in the studio, I am joined by board-certified psychiatrist, Dr. Karla Viera, and clinical psychologist, Jeremy Salzman of Path Group of Atlanta. Path Group of Atlanta specializes in adult, child, and adolescent psychiatry and therapy. Thank you for being guests on today's show.
Thank you for inviting us.
Oh, thank you for having us.
Today's real chat topic is titled Depression and Anxiety in Our Kids. According to Society of Development and Behavioral Pediatrics, 2.6 million American children and adolescents suffer from anxiety or depression in 2011 to 2012. As it relates to children, what is the difference between anxiety and depression?
So, anxiety is the excessive fear or worry, whereas depression is an overwhelming feeling of sadness or loss of interest in previously enjoyed activities. So, that's really the main difference between anxiety and depression. Though they are different, people with depression often experience symptoms similar to those of anxiety, such as nervousness, irritability, and problem sleeping and concentrating.
Okay. In toddlers, sometimes they experience, I guess, from ages 1 to 3, separation anxiety. How is that different than regular anxiety?
Exactly. So it's important to understand that there's definitely some developmental anxiety that it's completely normal or within normal limits. I think for every diagnosis that we make, there has to be a problem with functionality, right? So, for example, if a toddler goes to daycare, they usually tend to get used to a new environment around probably like around 1 month, right? But if, for example, the kid like keeps going to daycare, it's been over a month and they're kind of like suffering, they're very anxious, then you know that it's probably a little bit more than what we would call normal, quote unquote. Of course, at that age, there's not a lot you can do with the kid, but you can do a lot with the mom or with the caregiver.
Okay.
Right? So kids do tend to sense a lot like what their parents are feeling. I always say daycare is hard for every mommy. So when you go there, you have to hand in the kid, keep calm. If you want to go cry in the car.
Right.
But don't do it in front of the kid. But that's basically kind of like how we see it. It's definitely neurodevelopmentally normal to have some fears.
Okay.
And also temperament. Like a lot of the kids, when they're born, you're born with certain traits. So some of them tend to be a little bit more comfortable with themselves and with strangers versus other ones a little bit more what we call slow to warm up or a little bit more shy. And that's okay, of course.
Okay. Now, I noticed when I have 2 girls, my first, she was pretty easy. Dropping her off, we had like a church that had a mother's morning out. She was pretty easy. It took her, after meeting her teacher, she was fine because she saw the other kids and she wanted to play. With my second one, it was a lot harder, to the point where I would sit in the parking lot because they would call me to come and get her. It took about a month. And then her teacher finally told me, she's like, you know what? We're just going to keep her off all day. I need you to remember this rule. I tell all parents this. Stop, drop, and roll. Drop them off, roll out. So it worked after about a month. So I can totally relate to the, you said it takes about a month for them to get used to a new environment. I could totally relate to that. It took her about a month. But a month of me sitting in the parking lot and crying.
Which is, super hard for a mom.
Yeah. So anxiety, not depression, is the leading mental health issue among American youth, and it's rising. According to the Washington Post in April 2018, the Journal of Developmental and Behavioral Pediatrics collected data from the National Survey of Children's Health for children ages 6 to 17. 20%, they saw a 20% increase in diagnosis of anxiety between 2007 and 2012. Depression increased 0.2%. So what are the symptoms of generalized anxiety?
So, before I sort of get into that definition of generalized anxiety, it's important to note that anxiety disorder encompasses many other disorders.
Okay.
There's separation anxiety disorder, which sort of you just touched on with Dr. Vieira. There's also specific phobias, selective mutism, social anxiety disorder, panic attacks, as well as the generalized anxiety disorder. And with generalized anxiety disorder, what we see is someone who has excessive worry more days than not for at least 6 months about their performance at school, their job, with friends. They're just, what I like to say, it's worrying about worry. You're worrying about a lot of different things, and it affects your concentration, it affects your sleep. Some people get stomach aches, headaches, they feel tense, they feel on edge. So there's a lot of things that come with generalized anxiety. And I also like to say when I'm working with families and kids is that we have a lot of thinking errors. And I'll just give a couple of examples. One is overgeneralization. So example of a kid who gets a bad grade on a math test, whether it's a B or a C, they say, oh man, I'm going to fail the class. So that one little test, they overgeneralize and they just get really anxious. Another one is sort of along the same lines. I'll use the math test again, where they get like a 93 on the test, but they only look at that one question they got wrong, which I call discounting the positive. They don't look at the whole picture. They just look at the one thing that they get wrong. And so that creates that anxiety for them.
Wow. Okay. So, what are the symptoms of depression?
So the symptoms of depression, like you mentioned, also there's a couple of different subtypes of depression. But if we talk about what is a major depressive episode, for example, it has to last at least 2 weeks.
Okay.
And it has certain criteria, which can be feelings of feeling persistently sad. A lot of sometimes people have kind of like low energy, low motivation, like the things that they used to enjoy are really not that enjoyable anymore. Problems with concentration can happen, changes in weight, changes in sleep. In teenagers and in kids, it comes out a lot as irritability. So that's a big difference in between kids and adults in how it comes out.
Okay.
And for both for kids and for adults, it's kind of like this sense of life. It's really, sometimes it's like, it's boring or it's just not worth living. Like I don't see any hope for the future. In the very bad stages, when it's more severe than suicidal thoughts. And when they get to that point, it's definitely very important to address.
Okay. Who's at higher risk?
So interestingly, in terms of genders, they are similar. They used to say before that females were more at risk, but the newer studies, it's similar. And in terms of suicide, which is important to talk about, girls or women tend to attempt more than men, but men tend to complete it more often.
Okay.
So that's with genders. In terms of ages, it really depends. We can see it from pretty early on. Middle school is a really tough time for
Yes.
kids.
Okay, so I once read that treating anxiety in children for a therapist, social media is the bane of a therapist's work. Is that true? How much does social media play?
That's a great question. It's a hot topic today. And I think there's more and more research being done on how social media is, impacting kids and whether it's a causation or a correlation of developing depression or anxiety. I think it definitely has an impact on children and adolescents who are susceptible to depression or anxiety. And so I think one of the research studies I was reading recently was saying that the more social media platforms an adolescent uses, the more likely they are to have symptoms of depression or anxiety, regardless of overall time spent on social media. So that's like that feeling of, feeling isolated even though they're not, that FOMO experience, fearing of missing out. But I think it also just depends on how you use social media. I think one of the things, if it's a supplement to face-to-face interactions, it can be a very positive experience in terms of connecting with friends and family and talking to them. But I think with children, adolescents, and even adults, we find time when we're just taking breaks or, taking a break from work. We sort of scan and look at Facebook, Snapchat, Twitter, Instagram, and it really can have an impact on our mood. And so I think it really does depend on how you use it. And one of the key things that I also was reading is with children and adolescents, there's a key period where we're developing the ability to regulate our emotions. And what I see happening is that children and adolescents are sort of distracting themselves from those intense emotions by using social media. So they're not learning the ways to cope with intense emotions. So that is a really difficult thing for parents and children because this is such a new era of technology and how do we control it. And I know hopefully there's another episode where we can talk more about social media because it is a very hot topic.
Absolutely.
And to add a little bit also,
Yeah.
it's just when you see social media, you're seeing, of course, like the best of people. You're not really seeing that full picture.
Right.
So when, especially with kids, they really don't understand well that concept. So they start comparing themselves and it's okay. So everybody's having fun. Everybody looks great all the time and I'm different. When of course it's not.
Right. And I feel like kids are worried about how many likes they get.
Oh,
yes.
absolutely. Like Snapchat with the streaks, and it's like how many likes. So it is. It's feeling, because I think if you're not getting that and you see other people getting likes, it's, you're feeling as if you're not satisfied with yourself.
Right.
You're inadequate. And that internalizes and you start feeling maybe anxious or depressed or feeling sad.
And it goes all the way back to what you were saying in the beginning of just focusing on the negative, like those thought distortions. Because instead of saying, well, maybe people have not seen my post yet.
Right.
It's kind of like, so they saw it and they didn't like it.
Right.
So working on those thoughts and identifying those thoughts, it's important.
Okay. So a child that's been diagnosed with ADHD, do they have an increased chance of having depression or anxiety?
Yes. Yes. So in terms of comorbidities, they say about 80% of people with ADHD can have another diagnosis in their lifetime. Anxiety and depression can be one of them. One of the not so talked about symptoms of ADHD is having kind of like a fear of rejection. So when you're getting also that feedback from people, even if it's imagined, right? Like people are not liking me, they're not liking my posts, then it brews inside and it definitely can heighten the symptoms.
So according to Elements Behavioral Health, 25% of teens and 30% of teen girls have an anxiety disorder. Do you see more anxiety and depression in girls than in boys? And why do you think that's so?
So, I think there is, and I think with girls, I think there's still that stigma with boys that they can't talk about their emotions or it's not good. And so with girls, they're more likely to come and communicate with their parents of what's going on. So I think we've come a long way with the stigma of having anxiety or depression, but I think it's still there, especially around boys, and it's hard to talk about those emotions.
So what's the difference between a panic attack and an anxiety attack? Or is there a difference?
Great question. There's really no difference.
Oh.
Yeah, it's called, like, in terms of terminology, it is panic attack, but a lot of people don't understand the word panic, so they can say anxiety attack, but it is the same.
So the symptoms for an anxiety attack, is it different in a child than in an adult?
It's not.
Okay.
The symptoms are fairly the same, and so what a panic attack is, just to give the audience an overview, is that it's an abrupt surge of intense fear or intense discomfort that reaches a peak within minutes, and then it's accompanied by other symptoms like a pounding heart rate, like a lump in your throat, like you can't breathe, like you're choking, a discomfort in your chest. Like often people go to the hospital because they feel like they're having a heart attack or feeling like they're dying. They feel like they're going crazy. Those are some of the symptoms that accompany a panic attack, and it can be really scary, and it can seem like a medical issue. And once you get to the hospital, they say, it's just a really intense, you had a panic attack.
Wow. According to Anxiety and Depression Association of America, 80% of kids with anxiety disorder and 60% with depression are not being treated. Does that surprise you?
Sadly, it doesn't surprise me.
Yeah.
Yeah.
Is there a connection between bullying and depression as far as the victim and the bully?
Yes. We say bullying affects pretty much everybody, right? It can affect the person that is bullied, of course, because then they feel small, they feel powerless in a place where they're supposed to be safe, which is school. And then if you look at the actual bully, why is it that they're being so aggressive? What's behind that? What is the motivation towards that? It's kind of like that externalizing symptom of aggression. So where is it coming from? And in that dynamic, interestingly, the one that actually has the power is the bystander. So really kind of like teaching the kids when they are bystanders how to manage it, it's key.
Okay.
It's very important.
Okay. So if a parent suspects that their child is suffering from depression or anxiety, what's their first step?
Usually, very first step can be, if we're talking about professionals, then pediatrician.
Okay.
A lot of pediatricians from middle school and on, they tend to give what they call like the PHQ-9, which is a scale
Okay.
to measure how the if there is any depression, and they can kind of like go from there. The good thing about the pediatrician also is that hopefully they have already established a relationship with the child, so children can feel more comfortable talking with an adult that it's not their parents.
Right.
It happens pretty commonly. And then the pediatrician can really make that decision of what is the next step.
Okay. In addition to treatment, whether it's prescription drugs, therapy, is there anything else that parents can do to manage the symptoms?
I think it's not only just the parents, but the person that's seeking treatment themselves. I often say if one that's having mild to moderate anxiety, depression, that exercise or physical activity is one of the best medicines that you can use to manage those symptoms of depression or anxiety. And it's, ideally 3 to 4 times a week for at least, 40 minutes with like moderate to intense activity, which there's a lot of research that's shown that it helps manage mood, improve mood, and decrease anxiety.
Okay.
And it's also and it
you're
also,
good.
in terms of just looking at it, because when we have anxiety or depression, it affects our sleep, our diet, and also not wanting to engage in physical activity. So it's important to sort of use those as foundations for treatment that can be done at home. So making sure you're getting enough sleep, making sure you're eating a healthy diet, and then also getting that physical activity.
So after visiting a medical professional, and if it's determined that the child could use medication to improve their health, what would you say to the parent of a child that refuses to take the medicine, say in middle school?
It is tough. It is really, really tough for parents and, of course, for professionals as well. Because if there's a kid that really doesn't want to take medication, you cannot make them take them unless it's a safety situation, of course. So there's a couple of ways to try to talk the child into it. There is a technique, we call it kind of like motivational interviewing, which is trying to understand first where is the person, because it can even be an adult, like where is the person at and their understanding in terms of their symptoms or how they're suffering, and where the person wants to be at, right?
Okay.
Like what is the goal? And then trying to explore with them, what do they think they need to get to that goal?
Okay.
And for a lot of kids, sometimes it just takes time. Sometimes they really want to feel powerful and I can do this by myself and I
Right.
don't need help. And having that space for them to explore it, and when they're ready to say, I think it's time to go back, it's helpful. And we see it a lot, especially middle school. I mean, I see kind of like two peaks of refusing medication tends to be middle school and tends to be also early college.
Okay.
And then, for example, if we look at middle school, once they start maturing and getting a sense of themselves, then in high school, they say, I probably need a little bit of help here.
Okay.
And in college, it's because for a lot of kids, like the parents kind of made them take medication. And then when they're off on their own, it's like, I do not need this.
Right. So, is depression and anxiety in children likely to occur throughout their lives?
I would say, start with depression. Depression, once you have a major depressive disorder episode, you're 50% more likely to have another one. And if you have a second episode, you're 90% more likely to have a third one. And after the third one, sort of recurs throughout your lifetime. And with anxiety is not curable, and it's not going to go into full remission. It's more of how can you manage it and tolerate it. It's definitely something that can go for like on a 1 to 10 scale, where 1 is you don't feel it at all and 10's extreme. You can definitely get it down to that 2 or 3 level, but I think it's not going to go away. You're going to have to, because other situations are going to come up. There's going to be stressors that may trigger it. It's learning to identify your triggers and learning skills to help manage that anxiety.
And I think also understanding that not all depression is equal, and not all depression has the same like risk factors, right? So if you see a person, for example, that there's a lot of family history with depression, or that it started without really like a trigger, or started very early in life, then those people do tend to be a little bit more, they do tend to be more at risk of having more recurrences, versus is it something that happened and they are reacting to that situation, and that has a better prognostic factor. Comorbidities, are they using substances? Are they do they have another psychiatric conditions? All of that can impact in the way how the depression is gonna develop as they grow older.
I once heard a saying that a parent is only as happy as their saddest child, which I personally think is true. What advice do you give parents that are actually going through having a child with anxiety or depression?
It's tough. It is really tough. But I think understanding that their brain is still in under development, right? They are going to mature. They are going to grow. They are going to start seeing other things. So how they are right now, that doesn't mean that they're going to be in that same stage in 5 years. And you can, as a parent, really, you can only try to be there for them and influence them, but the decisions are theirs.
And I think to add to that, it can be a very helpless feeling as a parent. And I'll say that I'm not a parent, but I see a lot of families and children that come in, and the parents just want to have a quick problem solving so their kid does not experience the pain that they see them in. But it's really like what Karla was saying, is just to be there for them. And one of the things that kids often say is, I just want my parents to listen to me. they don't need to problem solve for me. I just want them to listen and be there for me. And we can, if they come to you and say, I need help, then you can offer the tools, such as whether it's going to a psychiatrist or a therapist. That's when you know that they're ready to get help and to make some changes.
Which is interestingly like what we do in practice. We never tell the children like, oh, you should do this or you should do that. This is the way to solve it. We really explore what are their coping skills and how do they think that they can get better. And just being there as a support. A very good phrase that I like to use is like, how can I support you? How can I support you through this? Because then you're putting that power on them. Like, what do they need from you? Instead of trying to say, you need to do this and this and that, which is a very parent thing to do, because I think we all do it.
Right.
But really kind of like being mindful of, I probably shouldn't do this.
Right.
It's important.
So what should parents look for in a mental health doctor for their child? What should they look for?
So I think for a therapist, I think it's important to search and understand to make sure that that therapist treats the symptoms or the disorder that your kid is experiencing. So if your kid is experiencing anxiety or depression, make sure that mental health professional has a lot of experience with that, and also working with children and adolescents, because that's different than working with adults. So making sure the experience is there, but also having a good fit. Does your child want a female or a male? That's also very important, because I think the relationship between the therapist and the client and or patient is very important, because that helps develop that trust and rapport, so you can start, like Karla was saying, explore the issues that are going on to help them figure out their own coping skills to manage their anxiety or depression.
So where can our audience find Path Group of Atlanta, and what services do you offer?
So you can find Dr. Viera and myself. It's off Far Road in Piedmont and Buckhead. And the services we offer is we offer therapy and psychiatric services, correct? And so that's where you can find us.
Exactly. The website, I think it's important. Dr. Salzman has his own website.
Yeah, I do.
that you can say.
JeremySalzmanPsyD.com or Path Group. Is it Path?
ATL.
Exactly.
ATL.com.
Pathgroupatl.com.
Yeah.
So I think that would be a good way to start, and and we can say our phone number.
Yes.
Okay. So the phone number of the office is 404-235-5982.
Okay. TheMighty.com asks people who live with mental illness to tell their parents one thing they wish their parents understood about their condition. Mighty.com came up with a list of 22 things children with mental illness wish their parents knew. I picked 4 that I liked, and I hope it helps parents who have children that suffer from depression and or anxiety. The first one is, your support and understanding are everything to me. I am in awe of the lengths you have gone to try to get answers. And even when those answers didn't come, you still haven't given up on me, even when I want to give up on myself. The second one is, I'm not doing this on purpose. This isn't some attempt at rebellion, a guilt trip, or me trying to punish you. This is part of me. It's harder to deal with than you realize. The third is, thank you for putting up with my roller coaster. Know that I love you very, very, very much, even at my worst moments. And the fourth is, it doesn't mean you're a bad parent.
Oh, that's beautiful.
That's awesome.
Yes.
Thank you, Dr. Karla Viera and psychologist Jeremy Salzman, for joining me on the show today.
Can I add something?
Yes, absolutely.
Okay. Oopsie. Okay, so something that I always want to tell parents also is that we cannot see, especially anxiety, it is not all bad. Like, it does have some benefits to it if you think about it. People with anxiety tend to be more careful, right? So they're not going to put themselves in situations of risks.
Okay.
They tend to be responsible because they worry. right? So that anxiety can lead them to be more responsible in school, be more responsive to their friends, to their parents. So all of those things are good. And I think it's important to mention it also to the kids.
Okay.
Because this is something that you may have to deal with for the rest of your life. So trying to make friends with it and take that as a part of yourself and see that it does have its benefits. I think it's key. And it takes away the stigma.
Right.
No, yeah, I would agree with that, and it helps with performance because every child or adolescent or adult, if they're about to do something, whether it's a sport or tests, it helps you sort of rev you up and prepare you. But there's like sort of the mountain, and if there's an appropriate amount of anxiety, and that will help you perform. But once it gets too much, that's when it starts impacting your function, and it debilitates you, and then you can't concentrate. Like you often get kids that say, "I blanked out on my test once I started it." And that's when that anxiety gets too much because it just overrides their, what I call their thinking mind, and it just sort of shuts it down, and so they go blank.
Which is key to understand when is it that we come into the picture in terms of treatment.
Okay.
And that word, it's function.
Yeah.
Because you can have anxiety symptoms, you can even have depressive symptoms, but if you're still functioning in your life, then you're fine. It is within normal limits. Everybody has emotions. Everybody goes through some developmental anxiety, even as adults. But when is it that it's impacting function, then that's when you get in treatment.
Exactly. We all experience anxiety. We all experience sadness, frustrations. That's when the function is the key term. And I would recommend parents going to ADAA.org, which discusses and gives information about anxiety and depression. It's a nonprofit organization.
So ADA.org.
ADAA.org, sorry.
Okay.
Yeah.
All right. Sounds good. Well, 1 in 5 are at risk. So I really appreciate you both being on the show and giving us so much insight and tips for parents that are actually going through it with their children. Be sure to find Raising Mommy anywhere you listen to podcasts. Check out new episodes every Saturday. Follow us on Twitter at RaisingMommyGA. Search for me on Facebook and Instagram at eatplantsforlife.com or Raising Mommy Podcast. Don't forget to email me at raisingmommy@appenmediagroup.com to share the random, fun, and sweet things your kids say, text, or do for our Off the Cuff Kids segment. If your comment is chosen for a future show, you will win a gift card. Remember, first names only, and please include the age and grade of your child. If you have a screenshot of the text or note or a photo of the deed, please also include it with your submission. As always, thanks for listening.